Yeah, so this one, this one is the one that I learned and when I took Bio 1030 in the basement of the library. That's where I had that class with Dr. Kirk, who's no longer here. But back in 2000, 2000, it was fall of 2000, I had that class. Um, Most of you guys weren't born yet, right? Yeah, that feels weird. I don't feel like I'm that old, but that's okay. I am. Um, and that's the one I learned. But yeah, does anybody else have another one they've learned outside of these two or found that they want to share with the class? They're all like a little bit weird and a little bit funny, but nobody's willing to share that. Yeah, I'm sure there's some out there that are they're really funny, but you can just put it into YouTube. People do like songs about them and stuff, but yeah, the book has some too. So the way that they're numbered are from what's called rostral to caudal. Okay, so like the one that's the closest to your forehead, pretty much, is the first one, right? And then down through the cerebrum and down through the brainstem. 12 is down there at the very bottom. Okay. So, and you guys got to see some of these in the sheep brain last week, right? So, okay. Yeah, and I do want you to know the Roman numeral too. I know some of you aren't familiar at all with how to use Roman numerals, but you want to get familiar with 1 through 12 at least for for this, okay? Um, but then a lot of times if it's like if something I have you just put in like on the test, like some of those fill-in ones or whatever, I accept either one, whether you do the Roman numeral or the actual number. But I might refer to it with a Roman numeral, then you need to know what it is. So okay. All right. So let's talk about where each of them come from. So the cerebrum, right, the big top part of our brain, the first four pairs come from there. Okay. And then within there's none in the brainstem, or sorry, yeah, none in the brainstem, but then we see, yeah, underneath there, we've got the medulla oblongata. So most of them come from the medulla oblongata. That's the biggest part, right? And then we've got the pons, three pairs coming from there, and then the midbrain, nothing there. But so it's really just these two regions, and yeah, and then the cerebrum. So okay, so that's where they come from. And so we'll go through the first grouping first. Um, so yeah, these first four that we see coming out of the cerebrum, we'll talk about first. Okay, and one of the things you want to know when you look at the cranial nerves are you want to know the number, right? You want to know the name, and you want to know their functions. Okay, and then when we look at the functions are broken up into different categories. Okay, so that could be they could have sensory functions, right? Like providing sensory innervation to a part of your face or part of your body. Um, they could have motor, like somatic motor, so controlling skeletal muscles, causing your traps to contract, things like that. And then they can also have autonomic motor functions, right? So within our autonomic nervous system, so that'd be like the parasympathetic nervous system, contracting smooth muscle, contracting glands, things like that. Okay. So yeah, so this one's super easy. It's pure sensory, right? There's nothing else besides sensory neurons in this, and this is for smell, right? You guys remember that little cribriform plate in the ethmoid bone? There was that little shark fin sticking up on the top, and then on either side of it, there are all those little holes, right? And the little holes are where these fibers come through, right? So they stick through those little holes and come down to get into the nose. Okay, so that's number one. That one's easy. Number two is the optic nerve. Okay, this one is purely sensory as well. And this one obviously carries information from our photoreceptors and our retina back up to our brain. Okay, and we're going to talk a little bit about some of the nuances of the way that the fibers kind of travel depending on which part of the retina they come from. And that's what we'll talk about next. Okay, so we have this first part here going just from the eyeball back to this part where it kind of starts intersecting with other things. And that's the true optic nerve. Right there in the middle, where there's this kind of crossing point, called the optic chiasma, or it could be optic chiasm, either one. And then once we get back to this part back here, that's part where it's actually going to be connecting into these tracks where they're going to eventually get back to the occipital lobe. Those are just called the optic tracts. Okay, so the way that this works, and we'll dive into the eyeball more next semester early on, but the way this works is we have what's called the visual field. Okay, so our visual field, our right visual field is everything on the right side of our body, right? And so so the light coming from a right visual field. So light only travels in a straight line, right? It's not going to come into our eye and then like make a U-turn and come over here, right? So it's going to come this way, and into our right eye, it's only going to hit the medial side of our retina there, okay? And then it's also going to come into this eye, but it's not going to come in and make a U-turn and go over here. It's going to come in and hit the lateral side of this retina, okay? And the reason this is important is because our whole, the medial side of each of our retina, those neurons cross over through the optic chiasm and they go to the other side of the brain. Okay, so the medial retina from the left eye is connected to a bunch of neurons that are going to pass through this optic chiasm and go to the right side of the brain. Okay, same thing over here. The medial side of the retina on the right eye, sorry, all those neurons are going to go through here, go through the optic chiasm, and end up on the left side of the brain. Okay, so that's just the medial side. But then the lateral side of the retina, also known as the temporal side, those neurons stay on the same side that they started on. Okay, so they come in and go to the same side there. These ones come in, go the same side there. So it's all kind of color coded. Okay, so just kind of hold on to that thought there for a second. Okay, so the ones on the nasal side or the medial side, those ones have to cross through the medial or through the optic chiasm. Okay, so when we look at something like this, okay, so we got a little guy over here, a friend saying hi to us, okay, that's on the left side of our body, okay, that's going to be our left visual field. The light is going to come in like this, right? And so it's really only going to hit the medial side of our left eye, but the lateral side of our right eye. Okay. So light is coming from the left, right? It's our left visual field. And so on the left eye, it's going to hit the medial side only. And on the right eye, it's going to hit the lateral side only. Okay. So this is like this one here, right? Or sorry, this is like this one here, the left visual field. Okay. So the information from this eye is going to stay over here. Okay. And the information from this eye is going to go over there as well. So all of the information from our left visual field is processed over there in C, which is the right side of our brain. Okay. Questions on that so far? And we'll keep working through some examples of this. Okay. So if we go ahead, Matthew.
When that comes to play, like for the dominant that part,
Yeah, the dominant eye is not necessarily connected to this exactly. It has more to do with the idea that our right eye has kind of a certain visual field like this. Left eye has another one here. There's a little bit of overlapping that happens. And then there's a little bit of what the left eye can see that the right eye can't, right? So there's a little bit of overlapping between the two. And then there's a little bit of unique field of vision for each of them, right? And so if we saw both of the exact images that each eye saw, then we would have double vision, right? Because we're seeing two separate images, right? And so one of them has to kind of win out in that way, so we only see one image instead of two, right? And so that's the dominant eye thing, and how that actually develops, I'm not exactly sure how it's kind of figured out which eye becomes the dominant one or not, but that's why we need a dominant eye. So yeah. Other questions on that? Okay. So yeah, so now right field of vision, right? So we got somebody over there saying hi to us, right? The light's gonna come in just like this, right? So light is coming from the right side, right? On the right or on the left eye, that's gonna hit the lateral retina, right? On the right eye, that's gonna hit the medial retina. Okay, and then all of that information is gonna end up over in D, right? Because the left eye is gonna send that information there. The right eye is gonna send it there. It's gonna cross through the optic chiasm, and it's all going to end up over there in D. Okay. And then we can do the same thing for what we would call peripheral vision, right? So if we're looking straight ahead, but we can still kind of see out here, right? Even though I'm looking straight at the clock right there, I can still see both my fingers a little bit, right? And so in this case, light is really coming from both kind of extremes like this, right? And so most of that peripheral vision is dealt with on both retinas on the medial side. Okay, so light is coming from the outside, right, or the periphery. All right, so on the left eye, going to be medial. Right eye, it's also going to be medial. Okay. Um, and the bottom line is all of it has to cross through the optic chiasm with peripheral vision. And we'll kind of talk about a clinical implication of that in a sec. Yeah.
You said it all has to cross
The optic chiasm, which is B there, which is that crossing point there in the middle. Okay. Yeah. Yeah. So the information from the left eye will end up over in C. Information from the right eye will end up over in D. Yeah. Good. Okay. So then it's kind of the opposite with central vision, right? If we have something like right in front of our eyes like this, then most of that light is going to hit the outside of each retina, right? So it's coming from the middle, right? Left eye, and both of them are going to be lateral, right? So that information is going to stay over here. That information is going to stay over here. Okay, so it's just kind of a way to think through that. And so then for this next one, go ahead and on your clickers, decide damage to which letter would cause you to lose your peripheral vision. Go ahead, chat about it with your teammates for a second. Send in your answer there on your clickers when you're ready.
Oh, I've heard, yeah. But in every
But technically, is A and E also not correct?
Oh, you would lose all vision if you, yeah, that happened. Yeah, for sure.
I'm like,
Yeah, that's true. That's true. All right. So, okay. All right, good. There. Does anybody remember from lab and dissecting the sheep brain what little structure sat right above the optic chiasm? Anybody remember? The optic nerve, yeah. So there's a little structure that pretty much sits right above this right here in the brain. It's a pituitary gland, right? So the pituitary gland sits directly above the optic chiasm. So the patient presents with peripheral vision loss, or what's called tunnel vision. And one of the things you're thinking about is, do they have a pituitary tumor, right? Because that pituitary tumor starts pushing on the optic chiasm and makes it so they can't see on the outside because we're knocking out all those neurons that come from the medial retina on both sides. So, yeah, B. Okay. Questions on that? Okay. All right. Okay. So now we'll go on to the next one, the third cranial nerve, which is oculomotor nerve. Okay. So as the name suggests, it has motor functions, okay, for the eyes. Okay, so it contracts it innervates four of our six extrinsic eye muscles. We have six muscles that move the eyeballs all around. Four of them are innervated by this nerve. Okay, so first one's the superior rectus. That's the one on top. This one moves our eyeballs upwards. Okay, so it just comes in right here, pulls this direction, makes your eyes go up. All right, so superior rectus, inferior rectus as well. That one's on the bottom, pulls, rotates those eyeballs downwards. Okay, medial recti are on the middle there. Those are going to move our eyeballs in or medially. Okay, and then we have these two unique ones called obliques. And this one, the inferior oblique, is innervated here. And the way to think about this is this little diagonal movement here. So it pulls the front of the eye up and out. Okay, so the inferior oblique is shown right here. I'll show you some other pictures of it in a second too, but it kind of has this diagonal angle that it pulls on the eyeball out. Yeah, go ahead, Ava. Which one? Like this one?
Yeah. it's like-
Yeah. We haven't got that. We haven't got there yet because it's not innervated by the oculomotor nerve, but we'll see it in just a sec. Yeah. So we got 4 of the 6. So we skipped the superior oblique as well because that's also innervated by a different nerve. But we got the other 4, all of these ones so far. Not lateral. This one, this one, this one, this one. Yeah. Yeah. Okay. This also controls eyelid movement. So the muscles that move our eyelids are also innervated by oculomotor nerve, cranial nerve 3 as well. Okay. And then oculomotor nerve is also responsible for changing the size of our pupil. Okay. So its parasympathetic motor functions include pupil constriction. So those are our iris muscles, right? So the muscles in our iris, we'll talk about the names of those next semester and how they function and what they do. But for now, we can say it's just the iris, okay? And then we have another set of muscles deeper in our eye that control the shape of our lens too, okay? And so those are also innervated by cranial nerve 3 as well. Okay, so this one does a lot of stuff with the eyes. So has somatic motor functions. We can control voluntarily our extrinsic eye muscles, and then it has parasympathetic motor functions in these two, right? We can't voluntarily constrict our pupil or change the size of our lens. Those are all automatic functions. Okay, so that's cranial nerve 3. Cranial nerve 4 is the trochlear nerve or trochlear nerve. Either way is fine. This contracts just one muscle, the superior oblique. Okay. And this one kind of does not exactly the opposite, but similar movement, but just the other direction of the inferior oblique. This one pulls the front of the eye down and out instead of up and out. Okay. All right. So that's our first 4 cranial nerves. This one is called the trochlear nerve because this muscle is really interesting. It comes up this way. It goes through a little pulley. There's like a little loop right here. I have an image of it somewhere else. Maybe not till next semester. Can't even remember where I have it now. But yeah, it must be next semester. It goes through this little pulley-like tendon, and it totally like does like a 90-degree turn before it connects to the eyeball. And that little pulley thing is called the trochlea. And that's why this is called the trochlear nerve. Okay. All right. So then we got 3 coming from the pons next. So those were the 4 from the cerebrum. Now we got 3 coming from the pons. First one is number 5, which is the trigeminal nerve. Okay. Trigeminal because it has 3 branches, okay. And so it provides sensory innervation to kind of the upper anterior part of the head and the skull, and then the upper and lower jaw regions as well. So kind of all of this sensory information here, okay? And then motor for our muscles that move our jaw, move our mandible, right? Open and close our mouth. Okay, and you guys saw the trigeminal nerve in the sheep brain as well, right? Yeah. Okay, and then we got number 6, which is the abducens, okay? This one shows those extrinsic eye muscles. This is a lateral view, right? So we're seeing the lateral rectus muscle here, right? So this one does lateral movement of the eyeball. This you can see the superior oblique is right here. This is that little pulley thing that I was talking about, that muscle comes up, comes here, and then makes more than a 90-degree turn and comes back and connects to the eye. Super weird. Just path of movement for that muscle. Okay, so that's the first 6 cranial nerves. I want you guys to do just a brief little kind of summary of them here. Okay, so this kind of helps us summarize those. So go ahead and fill these in. So there's the sensory ones here. Here's the motor. This one in the middle does both. Okay, go ahead and fill that in with your team, and then send in the number of the nerve that has both sensory and motor functions. And you can just do the regular number there on your clickers. Okay, go ahead, fill that in, send in that number, chat with your teammates about it.
So the question is one is ocular motor. Then would be where
Optic two.
The branches, no, just in general, the what it does there, yeah. Mhm.
Like five, it was also two.
All right, so put that number in of the cranial nerve that has both motor and sensory functions out of these first six. Make sure to hit the send button on your clickers there. All right, I'll leave it open for a sec. Well, most of you are saying five there. So we'll get to those. So our first one here, that's just smell. Obviously, that's going to be the olfactory nerve, right? Sight's going to be our optic nerve. Our touch receptors in our face and head and forehead is, and then chewing muscles, that's going to be the trigeminal. That's number five there, right? And then we have the three that have some function over extrinsic eye muscles, and those you can use that acronym if you want. So we got oculomotor, we got abducens, and we got trochlear nerve. Interesting part about these two nerves is that's all they do. They control one little tiny muscle, right? It's a tiny little muscle in your eye. That's their whole function, is just to control that one muscle. So, okay. So this was five. All right, questions on any of those? All right, well, let's run through the next six and then we'll dive into the clicker questions after that. Okay, so number seven is the facial nerve. Okay, so the facial nerve does all three of the groups of things that these nerves could do, which would be it has some sensory information, it has some somatic motor, and then it has parasympathetic motor as well. Okay, so sensory for the anterior 2/3 of the tongue. Okay, facial expressions, those are our muscles that help us move our face around, and then our glands in our eyes that help us release tears and keep our eyes moist. That's the lacrimal glands, and then some salivary glands in our mouth as well. So all of that facial nerve, so lots of neurons coming out of the facial nerve, lots of different functions that it does. Okay, so that's the last one from the pons. And then we get to the medulla, where there's five of them coming out of the medulla oblongata. So we'll walk through these ones next. Okay, so the first one is called the vestibulocochlear nerve. And this is sensory information from the inner ear. Okay, we'll talk about all these little structures at the beginning of the semester, next semester in the spring, where we have what's called the vestibular apparatus, which is kind of the this whole section over here, which includes the semicircular canals, the vestibule, and some other organs we'll talk about more later. But this helps us know where our head is positioned and how our head's moving, which helps us with our balance, right, and staying upright. And then the cochlea is our organ of hearing, right? So that's the big snail-shaped thing there. And so we have the vestibulocochlear nerve, right? So there's a branch of it that goes to the cochlea, branch of it that goes to the vestibular apparatus. That's all sensory information there for the inner ear. Okay, so that's number 8. Number 9 is the glossopharyngeal nerve. So glossopharyngeal nerve innervates the back part of the tongue, the part that wasn't innervated by the facial nerve, right? So the posterior 1/3. Okay, and then some in the throat as well. We have some taste receptors and things actually in our throat and on the roof of our mouth. Those are innervated by the glossopharyngeal nerve as well. And then it does motor input to our throat as well. Our pharynx is our throat. That helps us with swallowing. and then also stimulates some of our salivary glands as well. We can see those salivary glands right here being innervated by the glossopharyngeal nerve. Okay, so that's number 9. Number 10 is the vagus nerve. Vagus means wanderer. Okay, and so it's called that because it goes all over the body. Most of the other cranial nerves just limit their function to the head, maybe into the neck and shoulders a little bit. Vagus nerve's all over the place, right? It goes all over the body, innervates lots of things in our abdominal and thoracic cavities. Okay, so sensory information for our throat, thoracic organs, abdominal organs, motor control of our tongue and our throat as well. And then this is the big parasympathetic nerve, really, right? So this is going to do things like decrease our heart rate, increase our digestion throughout our digestive tract. Some of you maybe have had a vasovagal response before. Vasovagal response is the idea that sometimes when we see blood or when our finger is pricked or something like that, when we're giving blood or we have a needle poked into our body, we pass out. Right? Does anybody have that response? Yeah, some of us do. And it's not really something you can control. It's just a reflexive thing that happens, and it has to do with your vagus nerve. Because really it's the idea is it's actually like connected to animals that can play dead. So like a horn-toed lizard, a possum, those kind of animals. They when they're in a very fearful situation, they actually like pass out. It's not that they're faking it; they pass out, and their heart rate drops to like in the teens, sometimes into the single digits. And when your heart rate drops that low, you're not getting enough oxygen to your brain. You're going to pass out, right? So that's what happens. And so they think it's kind of connected to that. Is when we see blood leaving our body, or we see something threatening to allow blood to leave our body, then it would probably make sense to slow down our heart rate so we don't eject too much blood from our body, right? And so some of us have a stronger response to that, and we decrease our heart rate so we don't lose too much blood, right? We decrease it enough to where we don't get it up to our brain and we might pass out, right? And so that's the vasovagal response. But yeah, okay. Questions on that? Okay, so that's 10. Then we go to 11, which is called the accessory nerve. This has motor function only, motor function to control the sternocleidomastoid muscle, which is that one sticking off your neck right here, right? And then your trapezius muscles, right? Traps. Okay, so your traps and your sternocleidomastoid. And then the last one, number 12, is the hypoglossal nerve. Hypoglossal does motor control of our tongue. And we have two kind of groups of muscles in our tongue. We have intrinsic muscles, which are muscles that originate in the tongue and end in the tongue as well. Those are the ones that help us change the shape of our tongue, right? So that people can make like little flowers and stuff with their tongue. You got good control of your intrinsic tongue muscles, okay? Or just folding your tongue in half like this. Those are all intrinsic. And then extrinsic tongue muscles are the ones where you can move your tongue up and down and all around. Those are originating outside the tongue and then coming into the tongue to move it, right? So both those groups of muscles are controlled by the hypoglossal nerve. Okay. All right. So a brief little summary of the last 6, and then we'll move on to some questions. Okay. Go ahead. Go ahead and fill that in. I don't have a clicker question for you on this one. Sorry, say it again.
For intrinsic, you said the muscles originate in the tongue and then stay in the tongue?
Yeah, exactly. So they can just change the shape of the tongue because of that, whereas the extrinsic, they start outside the tongue and then come into the tongue. Yeah. All right, let's walk through this together here. So we'll start on the sensory side there. So we got our nerve for hearing and equilibrium. That's going to be our vestibulocochlear. All right, and then we move down to the facial nerve, which has both some sensory innervation and then some motor control of some glands in the mouth and the face. Okay, and then we move over to the swallowing, the ones that control swallowing muscles, and then the taste. So that's a mix of sensory and motor. That'd be our glossopharyngeal, as well as some glands. And then again, taste and swallowing muscles, but then all the way down to smooth muscle and glands of our thoracic cavity, abdominal cavity. That's our vagus nerve. Okay, and then it has some autonomic, somatic motor, autonomic, and sensory function as well. And then the two that are pure motor would be 11 and 12, right? Accessory and hypoglossal. Okay, questions on any of these? All right, well, let's, yeah, go ahead, Karen. Yeah.
Can you keep on saying pure? Is that
Yeah.
also pure for sensory?
Sure, yeah. If there's something that just has sensory function only, then you could say it's a purely sensory neurons in there. Yeah. Sure. Okay, this next one is just a table to kind of refer back to, okay? With all the numbers, names, functions there. Okay, so let's dive into a couple here with all of these. I'll just have you answer with a number. Okay, so go ahead and read that, chat briefly within your team, and send your number in. Make sure to hit that send button. Just the number, yeah.
Just hold up the number.
No, send it on your clicker. Yeah. Yeah.
Touch and feel, break it a little bit.
All right, go ahead and hit send if you haven't yet. All right. Almost got everybody. Looks like most of you are saying 8. What's 8 called? Vestibulocochlear. So our cochlea, even though it's mostly for hearing, it also is connected to nausea and vomiting as well. So, all right, so that's 8. Okay, now we got this one. Go ahead. We can block the actions of a cranial nerve, and then we'll kind of see the opposite effect of what would happen if we were able to activate it. All right, anybody else? Go ahead and hit send if you haven't. All right, yeah, so most people are saying 3, it's the oculomotor nerve. This will be blocking the parts of this nerve that are innervating the muscles in the pupil, right? Those iris muscles, and so it makes that dilate. Okay, how many people have done this when they go to the optometrist? They put those drops in, and you gotta wear glasses the rest of the day because it can hurt your retina. Yeah. Question or
There's 2 sections of the oculomotor motor and then parasympathetic.
Uh-huh.
Does it matter which one is it the parasympathetic or is it like both of them?
This would be parasympathetic. Think about it in terms of what can we control voluntarily and what can't we control voluntarily. So we can't control the size of our pupil voluntarily, so then it must be the parasympathetic side. Yeah. Uh-huh. Yeah. Okay. All right, next one.
Oh, yeah.
Oh, wait. Oh, I know. Wait, 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 wait.
From one, wait, we went ahead. We started going. We started going. That's all. The next one is over.
Wait.
All right.
Like, you didn't have to know.
Anybody else?
Yeah.
Yeah, I got most of you. So everybody's saying cranial nerve 1 here, which would be our olfactory nerve. So this can happen, right? You get some broken bones up in the face here. This can happen with car accidents too. It can damage some of these neurons here and lead to loss of smell. So, okay. Next one. Sometimes when nerves get damaged, they don't lose their function, but they kind of become over responsive and you feel too much innervation from those nerves, too much activation. So which one would this be?
Oh, would it be the chart?
Oh my goodness. You're this week, and then it's like, and yeah, and I was like,
All right, go ahead and send it in if you haven't yet. Okay, so we got 7, the facial nerve, and then about 3/4 of you saying 5, the trigeminal nerve. Just check with your teammates real quick on that. Which one do you think it is? Facial or trigeminal? Your answer's worse. It's the trigeminal nerve. All right, so that's all of that sensory information in your face and your forehead. All of that is controlled by the trigeminal nerve. Okay, all right, next one. Which one controls eyelid function? All right, send in your answer. Go ahead and hit the send button. Okay, good. So yeah, about 3/4 of you are saying 3, the oculomotor nerve. That is one of its functions is those muscles controlling the eyelids. Okay, next one here. What do we got? This one, we don't have to do this one on the clickers. That one's obvious. That's the optic nerve. That's fine. We'll do some more on the optic nerve next, though. Okay. All right, so here we go. So vision from the left eye, completely. I'm going to switch it back to letters here for this. So you're choosing the letter of where the damage would be. So all the vision from the left eye. It's not the same as the left field of vision, right? That's different.
If they lost then if it was C, then the right hand.
Because B would also.
Maybe it is.
I think it's. I think it's. If you don't do A, then it would be all then B.
All right, most of you have sent it in. So most of you are saying A. All right, so if we cut off right here, nothing's getting through from the left eye at all, right? So that would be left eye completely knocked out, okay? What about peripheral vision? We already did that one. We don't need to do that one again. That one is B, right there in the middle. What about this one? Left visual field now is different than left eye.
Yeah. Yeah.
No, I'm gonna.
Huh?
You're gonna be in my project.
All right, go ahead and send that in. Give me about 10 seconds.
Oh, no. I was looking.
All right, good. Most of you are saying C. All right, so left visual field would mean something over here, right? So something over here, the light's going to go in like that. It's going to go in like that. This information is going to stay on the same side. This information is going to cross over. It's all going to end up over there at C. Okay, questions on that? Okay, all right, a couple more here. Back to numbers here.
Yeah. That's certainly. Where's like, I got a psychology teaching.
He's got so many followers now. It's crazy. Huh?
I'll be back.
When he just started.
I know him well. Yeah, we came in together. We started together. Yeah, 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 yeah,
Psychology.
yeah. Max Butterfield. That's what he does every time. Yeah. All right. Yeah.
How did you get 11? You were afraid that.
All right. So most of you are saying number 11, the accessory nerve. Good. Because that controls which muscle? Trapezius. Good. Okay. Next. What do we got here? Poor Leonard. How are you pronouncing it? Leonardo. Leonardo DiCaprio, not the same. Exactly. Or Da Vinci, either one.
I just know my face is so bad. You can't go this right? Right, I don't know that. Yeah, those things are. Oh, wait, I don't want to. I don't want
All right, go ahead and send it in if you haven't there.
Whatever this one is, what number?
So most of you are saying 6. What's the name of this one? Abducens. Why is it called abducens? Anybody know? Abducts your eye, right? So moving away from the midline, abducts your eye. Good. All right. Okay, a couple more here. Here we go.
Okay, so.
Poor Sally.
Oh, yeah. No, wait, that's.
Excuse me, facial hair. It's very funny. I didn't think about that. I'm seeing a few of these that need to be updated in my stuff. It's fine. Okay, that's a really good point. All right. Well, you are saying 12, so the hypoglossal nerve here. Too focused on the mustache. Yeah. All right. Couple more. Okay, what do we got here? Look at you writing again. Feeling good? Yeah, nice. It makes life a little easier, huh? Yeah, yeah, yeah. Totally. All right, send that in if you haven't yet. Okay, good. So most of you are saying 7, facial nerve. This is actually a thing called Bell's palsy. A normal virus, like a cold, can just a cold virus can get into your facial nerve and lead to some temporary paralysis of your facial nerve and cause this Bell's palsy syndrome. So, okay, last couple here.
Like causing those causes, like the trauma, or the traumatic, not trauma, like the, how hard it is on your body.
I haven't heard of that one, but yeah, have you heard that? Yeah,
I just heard, well, someone had those causes.
during pregnancy. Yeah, yeah, yeah. I hadn't heard of that, but I wouldn't be surprised. No.
I think so. Not 6, like I said.
All right, send that in if you haven't yet. All right, which muscle are we dealing with here? Sternocleidomastoid. Yeah, accessory nerve, which is what most of you said. Okay. And then last one here, gag reflex, swallowing.
Is it not the fossil? Oh, yeah, no.
All right. Most of you put 9, glossopharyngeal. We got it. We're good. Right on time. Okay. All done, guys. We'll see you on Wednesday. Our last class.
Crazy.
That's official class. We'll have a review.